What's up, everybody? This is Victor from Cyborg for Life, and I want to welcome you to episode 17 of Lengthening Live. Wow, we're really piling them up here. Well, today we have a different type of live stream because we have a few guests and a little bit of a roundtable discussion. We have Moshe Roth, an expert physical therapist in limb lengthening and deformity orthopedic rehab, and we also have HJ, Height Journey. He was on a Lengthening Live, I think. Which episode were you on?
2 months
HJ?
ago, 2.5 months ago.
2.5 months ago. So, guys, he was. I think you were still lengthening at that time, right, HJ?
I was consolidated.
Oh, you were consolidating. Okay, well now
early September, yes.
Yeah, now you're really consolidating because you have some really cool videos on your YouTube channel. And guys, I posted HJ's Height Journey's YouTube channel link in the description, so be sure to check that out. I mean, he has some amazing videos. I mean, things that I couldn't even imagine doing. Some really, really good instructional videos of how to get in and out of a car with a walker, transition from the toilet to the shower. And I mean, it's just amazing. And he does really, really detailed work. So go check him out, subscribe to him, follow him. And if you have any questions, be sure to comment under his videos. And we have expert physical therapist in limb lengthening, Moshe Roth. This guy, we've had him on several times, and for good reason, because he is the best in the world at what he does. He's just finishing a late night session with a client, and he's here to join us on the live stream. Moshe actually has a new website. It's mrothpt.com. It just went live recently. So you guys, if you want to reach out to him for questions about physical therapy, or if you want to consult with him, he has a contact form on there. You can do that there, okay? Well, we are back. I know I had a few weeks of a little bit of a sabbatical, but just got caught up with work, a little bit busy. But we're back today, and we're going to take you guys' questions and answer them live on the spot. So I had a few questions that were submitted recently today, some from the YouTube comments, but we're going to go ahead and answer those. So I think this one is from a patient. This will be really good for you, Moshe. So this patient was asking, how can I learn how to do the basic tasks right after the surgery? How can a patient who gets lengthening done with a non-weight bearing nail get around with a walker? So like how after surgery, they're going to get you up right out of the bed and try to teach you how to ambulate with a walker. What is the basic fundamentals that a patient needs to know about, right as they wake up from anesthesia?
Great question. And Height Journey, you could probably know from personal experience, and you can comment in a little bit too. But there's a lot of upper body strength that's required. And one thing that I sometimes neglect to tell my patients, when they're doing their pre-rehab, what things should they do aside from stretching and hydration and all the things they do before surgery? Probably some good like tricep sit-ups, push-ups. Like at the edge of the couch, at the edge of the steps, just because those triceps are going to take a beating from all of the weight bearing and transferring that they're going to have to do with a walker. There's really, especially with a non-weight bearing nail, there's really not too much standing that we want the patients to do, especially initially when they're first waking up from surgery. So it's a lot of arm work, a lot of upper body strength, just sliding transfers. Maybe a very slight stand pivot transfers in and out of the wheelchair, but the reality is that there's going to be more wheelchair use than walker use. Until you get your legs under you, and until the doctor allows that.
Gotcha. And HJ, do you want to chime in here a little bit about how what was it like when you first woke up out of surgery, when you had your bilateral femur lengthening about 6 months ago, right?
Yeah, in March.
March. Yeah.
That was 8 months ago. So
yeah,
it was like when right after surgery, you don't start. There's no way you start walking right away. Like I was in the hospital for 3 days after surgery. So like I remember day 0 after surgery, you're just on the bed all the whole time. Day 1, I start to learn how to transfer from the bed to a chair, and then from a bed to a wheelchair, and then learn how to use a wheelchair. And also do some PT exercises on bed. Then day 2, I was doing some the day 2 morning, I was doing more of that same thing, some more. Mm-hmm. And then later on in the day 2, I was starting to just use a walker. And then day 3 I left, and then I was discharged.
Discharged after that.
So, but you use a lot of upper body strength, and the first few days is your legs are just swollen and weak, and you're just gonna not going to do much with your legs anyway. But
Yeah, I remember that. Lots of, like Moshe, like you said, a lot of pivoting, a lot of upper arm strength, and you're just going to kind of like try to get to the wheelchair and just stay off your legs as much as possible. But you definitely want to get up and move around a little bit to keep that blood moving. Very cool. All right, so the next question that we have, this question is really good for Moshe again. They kind of knew that physical therapy was coming this week. All right, so it says, "Hey brother, please answer my question. My English is a little bit bad. I'm from Morocco, and I went to do surgery in the U.S. What is the difference between physical therapy and rehab? I'm 26, so I don't compete in any sport. Do you think 8 centimeters in the femurs and working hard, I can go back to normal and walk normally and work out? Please answer."
Yeah, so the difference between physical therapy and rehab, rehab is, here in the States is typically used for post-surgery. That's really the classic sense of rehabilitation. Physical therapy is more all-inclusive. If somebody, if it's for a child or geriatrics, physical therapy is more the practice of getting people better and moving better. Rehab is when there was a definitive trauma or a definitive surgery, and then they have to do rehabilitate to get them back to even a baseline. But usually they're pretty much interchangeable. But physical therapy is more all-inclusive, the umbrella term of getting people better.
Okay, very cool. And for his second part of this question, I guess, HA, this is a really good question for you. You did 7 centimeters on your femurs. He's planning to do 8 centimeters on his femurs. He doesn't play any sports. You're starting to walk now really, really normally. Do you feel that if he did 8 centimeters at age 26, he could start to walk normally and get back to working out? Because I've seen your videos and you show that you're working out. What's the prediction for him?
Yes, he should be, as long as his muscles are flexible enough to allow it. Because some people, like, their muscles are not flexible enough and they can't reach all like 7 or 8 centimeters. But as long as his flexibility is good, it might take a little longer, but he should be able to return to normal, or mostly to normal. Yes.
Gotcha. Very cool. All right, moving right along.
8 is always the goal. A lot of folks want that 7.5, 8 centimeters. So that's their goal. That's what we help them get. And being 26, those muscles are a little bit younger, a little bit more flexible. So yeah, I don't see any reason why not to, with a lot of hard work.
Yeah, definitely. Awesome. Well, that's good news for him. All right, let's see here. So next up we have this next guy's asking, if I do 5 centimeters on my femurs, will I be able to lift weights and squat normally like I did pre-surgery? This is kind of like the same question. So yeah, if you're flexible enough and you re-strengthen those muscles, 5 centimeters, that's a pretty conservative amount. I'll answer that. I say yes. And working with a guy like Moshe, you could definitely do so. All right, so let's answer this next one. Moshe, this guy's asking, does the surgery throw off your mechanics for lifting? Are you able to deadlift and squat if you were to gain 8 inches in height? I think he means 8 centimeters. Yeah. The stride nail allows you to get this amount, and the surgeon promises, so basically, will he be able to, will the surgery throw off biomechanics?
So it definitely does. And one thing, and Height Journey, you can speak to this as well. One thing that it definitely has an impact in, say for example, standing up off a chair, which is similar to a squat. Right. The mechanics are now, the quads, the femur is now 3 inches longer than it was 3 months ago. Right. So your body has been pre-programmed to, function at a certain height, and your muscles are a certain length, and your biomechanics between your foot and ankle, your knee, your hip, your back have all been programmed for all these years to work that way. Now we've just added 3 inches to a femur, and it's definitely a different kind of activity. What I'm seeing now is that just that little activity of sitting up from a chair without using your hands takes a lot of work, because where everything was in sync previously, muscles have been weakened by the surgery, muscles have been lengthened by the surgery, and just getting everything back in sync takes quite a bit. But that being said, your body is going to have this new reality, and with a lot of hard work, with a lot of retraining, We expect that you'll be able to get back to, all the daily functions and activities in sports and lifting that you did before. But it does take quite a bit of retraining because we've just imposed 3 inches of length on, what was a previously fine-tuned machine. So
Yeah, exactly. Yeah, and
Right.
HJ.
That's what I mean. Like,
Yeah, go ahead.
yeah, because I'm not quite there yet. I'm still in consolidation phase. I'm not yet clear to. I can walk normally, but I'm not yet clear to do athletic activities yet. I think in about a month or two, I'll probably be able to start doing like squats and deadlifts. I'll like write videos in the future how it goes.
Yeah, but I
I read
actually,
some other people divers who like in the femurs. It's like your walking or running speed might go a little lower, but it might be easier because it's like your legs are longer. That's why. So it's like when you're batting, swinging a baseball bat, it's longer. So it's a little slower, but every time you swing, every time you make a step, you get a more step distance. That's why. That's what I read from others. But I'll report that in a few months. See how it's like
okay,
for
yeah.
real.
Yeah, so make sure you follow, subscribe to his YouTube, and you can find out. But I mean, you also have videos on your YouTube about you lifting with your personal trainer, doing some Romanian deadlifts, some
Yes.
leg press and stuff. Do you notice? I'm not sure if you worked out before the surgery, but do you notice any difference now that your femurs are now 7 centimeters longer? Do you notice any differences where the leverages are being applied to on the legs and stuff, or not yet? You can't tell.
Yeah, I noticed I'm getting a little more force out of it.
Okay.
When I
Okay.
like make a step, when I press leg press or something.
Mhm. Yeah.
And maybe it might help with jumping or not, but that's farther down the road. But
Yeah.
I get a little more leverage now because I have longer legs.
Yeah, more torque on those joints. Okay. All right, so we answered that. Let's see. I'm going to skip this one. Okay. So, Moshe, this is another good question for you because you've seen tons of patients over the years, and in your experience, this is going to be a really good question. So, he's asking, does limb lengthening cause arthritis? I read about it that it causes arthritis early, like at age 40 to 50. What do you think about this? Will someone who gets the surgery, let's say 2 inches or 5 centimeters done on his tibia or femur, would he develop arthritis?
That's a great question.
Yeah.
So I'll be totally honest. I'm not up on the literature regarding that. I think
Okay.
it actually might be a little too soon to to see what the long-term effects are on arthritis. But typically, arthritis is a joint issue, not a bone issue. So as long as the joints are intact, the meniscus, the synovial fluid, as long as the joint is intact, then I don't think there's been much of an issue with arthritic conditions because of the lengthening. If there's anything going on, aside from the lengthening, preconditions, that might cause arthritis. But I don't think there's a 1-to-1 ratio of causality between the limb lengthening and arthritis.
Okay, that's good news. All right, and HJ, do you have any fears of possibly developing arthritis, or you just got to wait and see, and you're happy?
Yeah, I haven't had any problems yet, so
yeah. Okay, very cool.
I don't think it's going to be a problem so far.
Yeah, and I think this is also a point to what you were saying, Moshe, about it's being a joint problem. If your muscles are flexible enough, there shouldn't be any excess pressure on the joints from the muscle tension, right? So that's another thing. So if your limb lengthening itself it's a bone issue. I mean, it's a bone surgery, so not a joint. Okay, so I think we cleared through all the ones that were submitted. So we have a few questions in the chat. Let's see here. So I'm going to answer Jen's question. Let me actually see if I can put it on here. How helpful is I'm going to ask Moshe this one. How helpful is a rower machine after the surgery? I'm going to have the surgery done next month. I'm planning to buy a rower. Is it going to be helpful?
So I'm a big fan of rowing. That being said, I think a bike is a better investment.
Okay.
Just because to really get a good row, you need a lot of knee flexion. So you on the one hand, you're using your body weight to flex, to force those knees all the way down to, as you get closer to the down to the machine, and then forcing back. You just want to be careful that you're not putting too much weight through your legs. You want to check that with your doctor, how much weight you can put through your legs. And also, as the lengthening goes on, it's going to get harder to flex those knees. I'd say a better investment is probably a recumbent bike. If
Okay.
if you're looking at different machines, as much as I love rowing, a bike is probably a better a better use.
Okay. Very cool. HJ, do you have anything to add to that?
Yeah, I think yeah, bicycle, not a full stationary bicycle, but one of those mini bicycle machines.
Yeah, like the
Mini,
little foot
look up
pedal.
mini bicycle pedal machines.
Yeah, like the QB. I've
That's
seen
portable.
that.
So it's going to be, you don't want a full stationary bicycle. That's going to be very hard to carry with you.
Yeah,
Carry on
sure.
with you.
Okay, very cool. So go for the stationary bike instead. The rower is not going to be as useful because it's going to take a lot of pressure on your legs. Okay. All right. Let's see what we got next. And big shout out to Randy in the back end. He's helping me out with keeping these questions on queue. So Randy, thanks, my man. So Moshe, here goes the next question from Nico. Will 5 centimeters on the femurs cause any denervation of the muscle? So yeah, that's a good question actually about nerves.
Shouldn't at 8 centimeters doesn't cause too much denervation, so 5 centimeters you should be just fine. It is one of those questions though, that I've always kept in the back of my mind, like our science says that you can't grow nerve, but somehow after 8 centimeters, the nerves are pretty much intact. So whether I haven't dug deep into exactly what's happening with all the soft tissue, the blood vessels and the nerves, and I know that the muscles get stretched, and I know that the tendons get stretched as well. The bone lengthens. What happens to the nerves, I'm not exactly sure, but I rarely have I seen any real denervation of any muscles going on.
Okay, great, awesome, yeah. And HJ, do you have any nerve pain right now that you're all done your lengthening?
No, I might on occasion get like a nerve irritation on my right front shin area or right front lower leg area, but it's just like maybe it's some tingling and then it goes away. But like any like major pain, no, I don't have any.
Okay, awesome. That's good to hear. All right. This next question here from Nico. This is for Moshe again. Sorry for blocking your face, Moshe, but the questions will be. I'll take it off in a sec. He's saying, does the atrophy on the tendons, ligaments, or muscle due to bed rest have any long-term residual effects? So for you, like for example, HJ's condition, he had a precise 2 nail and he was non-weight bearing for many months. Those muscles, the tendons, those soft tissues go dormant for a while. Moshe, does that have any impact when the person gets back up in a few months after surgery?
So it definitely, those first few weeks after consolidation, it's definitely hard. It's definitely a new experience. And no matter how much what we call, and I think we discussed this on one of the previous shows about open chain exercises, leg lifts, heel slide, ankle pumps, all those are open chain because your feet aren't connected to the ground. Once your foot hits the ground and everything has to package together, it's a whole different experience.
Okay.
And you could really feel the weakness, no matter how many leg lifts we're doing, super strong, put weights on them. Once you try to stand with your full body weight, that's a whole different experience. But that being said, it's like any other rehab and, therapy that we do. It's, it's not a long-term effect. It's just a short-term hurdle that we need to get on, that we need to get over.
I like that. I love that little statement you said. Not a long-term effect, a short-term hurdle. All right. Yeah. Okay. So let's see here. Okay, this one's for HJ from Randy himself. He's asking, HJ, did you get your IT band release? If so, any pain at all till now?
Yes, when I had my surgery, it was part of the surgery. So I did get an IT band release.
Okay.
There's like an extra scar mark, but it's not that bad. Just like the other scars, it's not that bad, and it was necessary.
Okay.
So if I didn't get it released, it'd be very tight.
Yeah. Do you have any pain now from that area?
No, I'm not experiencing any pain from that.
Excellent. Awesome. And okay, we're moving right along here. All right, let's see here from Soak ZZZ. Is getting 3 inches too much or 8 centimeters too much on your femurs? A lot of people say that if they only go for 2 inches or 5 centimeters, because they want to maintain their athletic ability. So this person's asking, I guess from you, Moshe, this will be a good question for you. You work with a lot of patients. Have you noticed from your patients that you work with who get more length than others, do they have a difference in recovery, or does it solely depend on that person and their recovery abilities?
Yeah, it's really individualized. You know, and it really depends on what the goals of the surgery are. You know, you know, somebody's going for 2 inches, somebody's going for 3 inches. They obviously have different goals in mind when they start out. But that being said, you know, the more length that one gets, the harder the rehab is, the longer the rehab is. But again, you know, with a lot of diligence, a lot of hard work, no reason that there should be a difference between 2 inches or 3 inches in what the end result might be.
Okay, gotcha. And HJ, you kind of smack dab in the middle there. You got 7 centimeters, so that's just about
2.75 inches. So,
look at that. These mathematicians.
So I'm kind of in between, a little closer to 3 inches. But so if 3 inches too much, I guess it just depends on the person. Like it's gonna feel more weird the longer you get, because you know their body mechanics is gonna be different the longer it gets than what you've been used to your whole life.
Yeah.
But so your athletic ability will probably go down the longer it goes, but probably not too much though.
Gotcha. Okay.
But
Cool.
I mean, but the reason people do cosmetic lengthening surgery is not to become an athlete, to get into the NBA or NFL or anything like that. That's not the reason why they do it. It's just for stature lengthening.
For stature alone. That's right. And we have Daka1 saying that he agrees with you, HJ. He exactly experienced that. By the way, big shout out to Daka1. I remember his comment from the other day. He said he just got his nails removed. So congrats, Daka1. I had to give you a shout out there. All right. Next question here. From Zenosama. Okay, what is the IT band release and how does it work? He apologizes for any ignorance, but he just wants to know what it is and how it works. HJ, you want to take this one?
About the IT band release?
Yeah.
Oh. Okay. The IT band release is like a large what do you call it, ligament that's on the outside femur, the outside femur.
Yeah, yep.
Like
it runs laterally in the femur, the tendon.
Yeah,
yep.
goes from the outside, it's the opposite of the groin muscles. It's like the outside from the knees to the hips.
Yeah,
it's like a large ligament. And what they do is they don't cut it, but they cut it like a diamond shape, so like it stretch more. Because if you don't, the problem is if you don't, like, I wouldn't say cut it, but just release it by making it more stretchable. If you don't do that, then you're gonna have like a cowboy stand. Like your legs are gonna spread apart while you're lengthening, and it's gonna be very tough, and you're gonna be limited, and it's gonna be harder to. That's why they do it.
Right. Hey, Moshe, and Moshe, can you add anything to that? Because I mean, you've seen patients all over the years, patients who've had IT band releases and stuff. Do you notice that patients who have that excessive abduction when their IT band isn't released versus when it is? Can you tell us a little bit about that?
Yeah, so like Ed Jay was saying, the IT band goes laterally along the femur from the hip joint, and it actually feeds in at the top of the tibia. So it goes past the knee, and it's sort of like a stabilizer muscle, and it's an accessory to many different movements. It doesn't really have a primary function. It just helps out with a lot of different things. So it actually helps out with both knee flexion and extension. So if it gets tight, then it could either start pulling the knee into flexion, or it could pull the knee into extension, and it really causes a lot of problems. Another issue, because it's on the outside of the knee, it could actually pull the knee, the tibia outward, and give a little bit of a bend, like a knock-kneed kind of posture, which is very hard to fix, while somebody's lengthening. But it could also get tight up at the hip joint as well, and like HJ was saying, it's going to pull those hips outward into a very wide stance. That's what a lot of people call wide legs. And because it's such a small muscle, it's also hard to stabilize, hard to stretch. So the doctors just go in there and release it just to make everything easier for everybody. You know,
Right.
as a PT, that's probably the hardest thing is stretching the IT band, because
Mm-hmm.
and because it goes laterally along the femur, there's so many insertions
Mm.
along the femur. You know, it's not just one long tendon and you just release it, but it has many attachments, so it can get tight anywhere.
I see.
So really trying to stretch it out effectively is very challenging, and we don't have, you know, great success. A great way to stretch it out is actually in weight bearing.
Oh,
But for the folks that are not weight bearing, it's even harder to do that. So yeah, so kudos to the docs that release it for us before surgery.
yeah, yeah. There's been some controversy about that of those who don't. So very cool. All right, moving right along here. This one's from Dark Uchiha from Naruto. I used to watch that when I was a kid, so that's cool. If someone wanted to gain 9 centimeters, would it be safer for that person to go for 9 centimeters on the femur or split it up in quadrilateral lengthening? HJ, you are a big fan of talking
Yes.
about quadrilateral.
Well,
Can you take it?
the both the precise 2 and the stride nails, when the stride was out, the limit is 8 centimeters.
Mm-hmm.
I think it's the Gouchet nail that goes to 9 centimeters, but they don't sell that in the United States. They don't use that in the United States. It's just the stride or not the stride, the precise 2, and limit is 8 centimeters.
Yeah, yeah, definitely. And do you think that if this person wanted a goal of 9 centimeters, should they split it up? Or let's say that they did have that option to get the Betz bone or the Gouchet, the G nail that they call it, that goes to those extreme lengths. Should they split it up, or should they push for that 9 centimeters in one limb length or one limb segment? I can't speak.
Yeah, when you go over like 8 centimeters, it'd probably be a good idea to split it up.
Good answer.
Because
Okay.
also the longer the longer you lengthen, the bone regenerate decreases.
That's a good answer.
Somewhere around 8 centimeters for most people.
And Moshe, this is a good question for you because you've seen patients not only for stature lengthening or discrepancies, but but people with large discrepancies who needed massive lengthenings, let's say 9 centimeters, and that may be possible for somebody with dwarfism or pseudodwarfism or some sort of condition. Can you speak to people who had those extreme lengthenings and how they fared with, like, let's say a tailored spatial frame or some sort of external fixator?
Yeah, like AJ was saying, if we're looking for 9 centimeters, probably better to divide it up between the tibias and the femurs, because we want to think about symmetry as well.
Yeah.
Which is very important. 8 centimeters is the max, and then if you go another centimeter, even though we think it's a centimeter, but just for symmetry purposes and also biomechanics, it's probably better to divide it up between the tibias and the femurs if you can. There's a lot involved. It's having multiple surgeries. It's having whether you do it at the same time or you split it up. That's also a factor. It's a time factor. But 9 centimeters is pushing it. Probably better to break it up.
Love that answer. Okay. All right, let's see here. This is a great question for you, Moshe, again, from Nico. He's asking, does high-level EMS TENS unit have any negative effects? So like I said, if you turn the intensity up. So you want to take that one?
I'm a big fan of EMS. Highly recommended. They have some great, I think we spoke about this on a different show also. They have some pretty good home units. You do want to be careful, though. There was a thing in the past called Russian stimulation that they used to use on their Olympic athletes to build muscle, and they used to zap their muscles pretty badly. So EMS is great, but you want you don't want to go beyond what you can tolerate. It is electricity, so you can get burns from it if you crank it up too high. But in general, EMS is a great tool to maintain your strength throughout the lengthening, and even to rebuild some strength right after surgery.
Very cool. And I actually am talking to a company who makes a great EMS TENS unit. I'm gonna try to do a review on that in the next month or so. So stay tuned for that. I love, and it's all because of you, Moshe. Like once you mentioned it in your initial interview, I was like, oh, gotta bring this to the people. So awesome. Did you use that at all in your rehab?
Yes, I did. I had a TENS unit, so I used it for it was very helpful for the first few weeks because my legs were so weak. I needed that extra, push, or that little shock or push. Yeah, it did help me a lot. But after about 1 month, I pretty much regained my leg strength. So I didn't really use it after that. But yeah, for like the first month, it was very helpful.
Yeah, I used one too. I remember my physical therapist was using it on me as well. Okay, moving right along here. Let's see here. All right, this one's a good one for you, HJ. Soaks is asking, is someone who gets 6 inches in the surgery, I guess quadrilaterally speaking, going to be extremely noticeable to other people after they get the surgery because they don't have the bone structure of a person of that height? So, they're basically saying because they're artificially gaining stature, will it be noticeable because of proportions to the outside world?
Oh, I guess because of your arm length isn't the same.
Yeah.
It's still the same while you're 6 inches taller.
Yeah.
Or like your torso is still the same while your legs are 6 inches taller. Yeah, definitely it's going to be noticeable. Once you get over like 2.5 inches, you can't really hide it though.
Okay.
You just have to just deal with it.
Yeah, it's one of the things that go with it. And again, it really does depend on the person, because Moshe, this will go to you. I mean, you've seen thousands of patients. Everybody has different proportions, right? Like if somebody has really long arms, if they get quadrilateral lengthening, it might actually balance them out a little bit better, right?
Yeah, it's all up to the individual. As a physical therapist, I love watching people, and like just a personal story. My daughter had a friend and their family over a few weeks ago, and I asked my daughter. I said, "Did their little brother have a surgery?" And she said, "I don't know. I'll ask." And she asked her friend. Sure enough, the little boy had a surgery in the past.
Wow.
And she said, "Like, how'd you know that?" I said, "I don't know. It's just one of those things that I noticed." So to a trained eye, you can pick out a lot of different things, but to the regular people, the regular folks just walking in the mall and keeping to themselves, might not be as noticeable.
Yeah, I love that you said that, because that's so true. I mean, I like to say that I have a trained eye, being in natural physique sports for over a decade. But then, the common, everyday person, they really don't bat an eye or take a second look at most people with proportions. And I know it's a big worry for people who are getting stature lengthening, but I can tell you this, that if you get the full 8 centimeters or you get quadrilateral lengthening, people really don't care, because a lot of people, the proportions vary so much. So that's my take on that. So all right, moving right along here. Alrighty, so we kind of talked about this in your interview, Moshe. I'll kind of let you take this one. Is taking vitamin D and calcium before the surgery good? And HJ, you can chime in after him.
I don't know necessarily before surgery. I know during the lengthening, it's pretty important. But I'm not up to date as to pre-surgery if that's effective. That would in theory make your bones a little bit stronger, but yeah, I don't know. I think during the lengthening and consolidation, it's more important than say pre-surgery.
Absolutely. For sure, it's definitely more important than HJ. Did you take vitamin D during lengthening?
Yes, I would recommend taking the vitamin D before surgery, at least a few months before surgery, because that improves your ability to absorb and process the calcium in your bones.
Okay.
I'm not sure about adding extra calcium before surgery, but definitely vitamin D, so it's in your reserve, reserve body, so that when you're right after surgery, you're having enough vitamin D, and then you can start right away with the bone rebuilding process.
That's a great tip. Okay, guys, so if you're getting the lengthening done, definitely load up your supplement cabinet with lots of vitamin D, or if your surgeon's going to prescribe it. Okay, moving right along here. This one's from Oregon, Ayana. Is it painful when getting the nails removed? Well, I can't ask HJ that, and Moshe, I don't think you've had a lengthening, so I guess I'm the only one who can answer this one. It is not painful if they knock you out, because it's an outpatient procedure, but you will feel tenderness and a little bit sore, and they prescribe you some pain pills for the first few days. You can take them if you don't need them. Most patients that I've talked to, they don't feel that they need them. They may take a Tylenol or two for the first day, but you just take a few days rest, take off, work for a few days, and you're back up by the next week, no problem. So it is painful to some people, but the majority of patients that I've spoken to, have said that it's not as painful as the initial surgery. So you can look forward to that, HJ. All right. Next question. Back with the Dark Uchiha. All right. So this one's for Moshe. For someone who's a regular gym goer, would it be possible to maintain muscle mass, at least in their upper body, if they continue to take supplements and use dumbbells, light dumbbells, I suppose?
Yeah, I don't see why not. You know, you can definitely, you know, do a lot of sitting exercises, a lot of, you know, sitting, you know, biceps, triceps. I guess if you're set up for it, even bench pressing. But yeah, you got to be worried about your stability and your core, because you know, if you're doing, you know, if you're on a non-weight bearing nail, you know, you don't want to rely on those legs for any kind of stability. So, you know, you could definitely do. You know, I would even imagine, you know, I've never seen anybody have this, but there's no reason not to. You know, if you get a chin-up bar and you put it in the middle of the doorway and you just do, you know, chin-ups out of your wheelchair, that would be a pretty good, you know, way to maintain your upper body strength.
Absolutely. Absolutely. That's a good tip. Yeah. HJ, what about you? Did you do anything upper body wise?
Yeah, do a lot of dip exercises where you're pressing downward, because you know
Right.
you need it for the walker, and when you for the wheelchair as well, when you're pushing it against the wheel to move around. Do dip exercises where you're pushing down, like
Yeah.
dip exercises supported by weight, and also your maybe decline dumbbell presses or something like that. That helps a
Yeah.
lot. That's
Yeah,
probably the
definitely.
most important thing. And about upper body strength, if you're doing like the precise two, which is partial weight bearing, which is 70 pounds most per leg, you might want to lose some weight on your upper body as well, at least for the lengthening and early consolidation phase, because you know it's partial weight bearing, so it'll be probably safer. I mean, you can always get it back after when you're done lengthening and you're the consolidation phase and walking again, but at least for the lengthening phase, you might want to get rid of some unnecessary weight.
I love that you brought that up, because I'm actually planning to shoot a video on that probably next week about body weight, ideal body weight, and length, you know, dealing with a non-weight bearing nail. And Moshe, if you could actually kind of chime in on there a little bit, like for patients who are, let's say, over, I guess, their ideal range of body weight, how is ambulating or using the walker more difficult? Should they lose weight before surgery, or do you recommend that they kind of just, you know, stabilize at their current weight and just kind of strengthen their upper body to kind of pivot the weight that they have? What do you suggest in your experience?
Yeah, so you know, the lighter is always better. You know, just like as HJ was saying, just, you know, because if, you know, if you're limited to 75 pounds,
Yeah.
you know, it just makes the rehab that much easier. But honestly, I'd say in my experience, I haven't seen too many really large folks getting
Okay.
stature lengthening.
Yeah.
They're pretty much all the same, you know, for the most part, you know, body composition.
Okay.
But I think I saw, I don't remember what I saw. I think I was perusing through different websites that I think certain doctors won't do it over a certain BMI.
Interesting. I didn't know that.
So,
That's
yeah,
cool.
I think I saw that recently, but I could be mistaken.
That's a good thing, because I mean, I know that I personally was dieting for a bodybuilding show before, and I lost a lot of weight, and it was much easier on me than if I was my weight that I am now. So let's just say that. All righty, moving right along here. Okay, this one again for Moshe, and then HJ, you can chime in after. From Benjamin, he's asking, the more you lengthen up to the 5 to 7 centimeter range, the more tightness you're going to feel. Can you explain what your patients that you deal with, Moshe, where they get tightest? I know you've said this in the past, like the posterior chain, but is there a particular muscle group that you know, like, hey, that's going to be tight, I need to kind of address that early, catch it early, keep it limber and loose? Yeah.
Yeah. So the way I've been explaining to patients recently is up until like if we could, you know, generically divide it into 3 stages, and HJ, you can comment on this too. Usually up to 3 centimeters, everything's going pretty good. You know, takes a couple of weeks to get moving, but you're moving pretty well. After 3 centimeters, things are changing. You notice the changes. feeling a little tight, not as comfortable sleeping, not as comfortable moving around, but your range of motion is pretty much the same. And that's about 3 to 5 centimeters. After 5 centimeters, 5.5 centimeters, that's when tightness really sets in. And it could be, you know, depending on how somebody's positioned. If they're spending more time in a wheelchair, their knee extension is going to get tighter. If they're lying in bed, then their knee flexors are going to get tighter. If they're, you know, just you know, if they're able to sleep on their side, you know, their hips are going to get tighter. So I'd say in general rule of thumb is that the hamstrings always get tight.
Yeah.
And followed by that, I'd say the hip abductors / IT band gets tight, and then the quads, knee flexors probably after that.
Gotcha. HJ, do you want to chime in?
What Moshe just said, it's about the tightness by each centimeter. That's pretty much what I felt also, and other diaries I've read as well.
But very important, because what I'm seeing now also with the precise is that the ankles, the gastrocs are getting tight too. So, you know, doing you know, whatever you're allowed, whatever weight bearing you're allowed to try to do some standing, even if it's a little bit during the day, just to maintain those you know, that neutral ankle position.
I like that.
Because without weight bearing, you know, your ankles are just, you know, those gastrocs are going to get tight too, even though you're not lengthening them, at least for, you know, with a femur lengthening. The gastrocs get tight. So I've been extra diligent in stretching those out too.
Yeah.
I was also experiencing tightness because after like 6 centimeters, I was getting a very slight case of ballerina foot, where it's kind of like points down a little bit. It wasn't too bad, and it wasn't, by the time I got to 7 centimeters, it wasn't that bad. But I was feeling tightness in my calves, and because muscles are all interconnected,
right?
And you find out they're all interconnected, and you're part of one body. And I was actually getting a slight case of ballerina feet, but I just had to stretch it out, and that went away. Well, that went away pretty fast.
Nice, lucky for you. I know mine because I actually lengthened the tibia, and I know that I had Dr. Conway was like, "Hey, Victor, go ahead, let that keep going. You're not going to keep bodybuilding." So, those that gastric muscle, just like motion HJ just said, gets really tight. So stay on top of all your posterior chain muscles, those gastrocnemius, hamstrings, and abductors, like Moshe said. All right, moving right along here. So I heard someone got 10 centimeters with the lengthening over nail method. Is that safe or not? That's more of a surgeon question, but like we said earlier, you want to kind of stick within the range of lengthening that surgeons recommend, which is below the 8 centimeters. All right, so Zenosama, who analyzes in detail the proportions before limb lengthening surgery and gives the advice for the patient to go for a certain amount of centimeters? HJ, you want to take this one? Because
yes. Before the surgery, like at least a month or two before surgery, you have a pre-consultation appointment with your doctor, with your surgeon, and then that includes taking full X-rays. And then during that, the doctor should have an advanced X-ray machine that has markers where it can get the exact measurements to the millimeter of both the femurs and the tibias. And then, they analyze the X-rays and also the length of each of the bones, including also the inner diameter. So which size to put in, which size of the rod to put in if you're using the Precise 2, and that's how they determine it.
Okay, very cool. So they use that advanced X-ray machine, and
yes.
That's excellent. So when they see these lengths of your bones and they measure it out, for patients who have, let's say, shorter tibias, but they know that they want more height, that's a dilemma, right? Because obviously the femurs can handle more height, but they want to lengthen their tibias that have perfect proportions. Does it come down to a battle of proportions versus height, or does the surgeon make the call? What happens there?
It's the surgeon only makes the recommendations and presents all the data to you, including like telling you what your tibia to femur ratio is and what lengths they are. But ultimately you get to decide.
Okay, very cool.
The patient decides.
Patient decides. It's your
But it
surgery.
would not be a really good idea to, like, if your femur is already longer than your tibias, then just continuing like doing asymmetry on the femurs, though, it's going to look really weird. But it's ultimately up to the patient. But the doctor can give good recommendations.
Awesome. Good to hear. Okay, so we have about 10 minutes left. We're going to take some more questions here. We're going to get through these. So this is actually a question from Randy, our mod back here, and it's for you, Moshe. Let me see here. It's actually, I'm going to pop it on the screen here. Moshe, I'm going to switch spots with me and you so you don't get blocked anymore. So I'm going to put you up there because you're the guest. I'm sorry about that. I should have thought about that, but here we go. I'll take that. Yeah, there you go. You're top. There you go. So this one's for you, Moshe. If you can see, it says, "Hey, Moshe, have you worked with lengthening over nail patients? If yes, do they suffer more compared to internal nail patients?"
So that's a great question. I mean, in the past we always used the external fixators. Lengthening over the nail is a bit similar. It's still something external, so that comes with its challenges. I don't think they suffer more. I think it's a different kind of lengthening, just like, having a precise versus a stride. It's just a different kind of nail, or having a gaucher nail or the Betz bone, all these nails have their unique qualities and characteristics. Cranking your foot to gain that length, from those European nails is a little bit different than the magnetic nails. So I don't think they suffer more. But might not be as comfortable as the internal nail.
Yeah, and what about for the like for the pin, because I know pin sites are another thing, because I know I had an external fixator. Did you notice that any patients with like the external fixator, when they do like physical therapy, like let's say soft tissue adhesions, like when they're doing like certain stretches, like lying prone, knee flexion stretches, I know I felt that in my femur a lot. Do you notice that your patients who have an external fixator on, like, let's say their femurs, feel that more than an internal patient?
Yeah, so that's what we saw, back, way back when with the external fixators. That whereas I said with the internal fixators, the internal nails, the hamstrings get tight. Usually with the externals, the quads get tighter. And also you have to think of the positioning of where those nails are, where the external nails are going. They're going right through the IT band. Yeah. So like I said, when you bend the knee, it's getting irritated. When you extend the knee, it's getting irritated. So, the body doesn't love having those nails through the IT band.
Right, for sure. Okay. All right. Next question here. All right, so this one's another one from Moshe. I really appreciate you guys coming out and asking a lot of physical therapy and rehab questions, because we know we always want to say how tall can you get, but you guys are respecting who we have on today.
You guys are asking great questions, really.
Great questions, great questions.
Yeah,
exactly. So when we have Moshe back, you guys, I'll let you guys know, and then you can ask more. So here we go. From John Jen. Part of my preparation for my surgery, I bought a med massager. Actually, let me just put it on here. Where is it? One way. Med massager, body massager, orbital electrical portable vibration deep tissue massage. Okay, it's basically, I guess it's a massage gun. Is this
massage
machine?
Gun, right?
Yeah, that's an easy way to say it. Is this machine helpful for after the surgery? There we go.
I think some of the patients have had it. And again, whatever gets you comfortable. That's it's so important to have that relief, whether it's EMS, to strengthen the muscles, whether it's a massage gun to make them more flexible, whether it's a hot pack or ice. Really, anything that works to get you more comfortable would be beneficial. HJ, what did you have any of those massage things?
No, I didn't have a massage gun.
You didn't?
No.
Okay.
Yeah.
Okay. Yeah.
But I don't think it's a bad idea. Like it's not one of those that is essential, and that it wouldn't be possible without it. But if that's what you like and that's what gets you comfortable and that's what makes it work, then for sure.
Yeah, definitely. I actually, I know there's a company that reached out to me last year or something, and I got a massage gun from Ekron Athletics. You guys can get it below by clicking the link below the description. But I think it's actually a really helpful tool, because it does help to make that muscle more pliable. And I just did a video about stretching and pliability of the muscle. And once you make that muscle more supple, even after, and you're like your stage where you are right now, HJ, after workouts and stuff, I noticed that within the first 6 to 8 months after I was walking, my muscles would still get tight. I would still feel a little stiffness in the morning. Using something like the massage gun, it makes that muscle so soft and supple that you're like, oh, the pain's gone. And you can use it a few times a day. So maybe look into getting one, or some sort of EMS, like Moshe said, something to kind of condition your muscles. It's really helpful.
Yeah, I was surprised. Like, this is the, how a PT watches football. So I was watching a football game, and I saw that on the sidelines, a guy ran off. I guess it must have had a cramp, and they have like portable massage guns on the side of the football team.
I'm telling you, man, that it's so useful, and I think they really blew up in the last I don't know 5 to 8 years, and they're big. They're very good for recovery and rehab.
Yeah.
Okay, so this is a good question. I guess I'll ask you, HJ. How long after surgery does it take to gain your pre-operative weight back? So, what body weight were you before surgery, and what weight are you now? And then,
Okay. I was before surgery. I was about 160 pounds.
Okay.
And then I dieted it down to 150. Lost about 10 pounds just because of that. It was a precise 2 nails, and that was my weight pretty much throughout the entire lengthening phase, and into the early consolidation phase. And then like a month after consolidation, I got to like 155, and then slowly gained it back. I think about 163 now.
Okay. So you're close to you're getting back up there.
So it's not too hard to gain weight, but I was kind of keeping it down because of the precise 2 nails. But
right,
and that was also kind of like it's harder to get around. So I didn't really have. It was harder to, find food to make or eat. But that was the reason why. But it's not hard to gain your weight back.
Okay, very good.
But you have to remember your limits of the precise nails. That's what I had to do. The limits.
Right. Yeah, mate, watching out for those nails. I mean, that's your most important thing. Get your length, let those bones heal. All right, let's see how many more questions.
I would add to that. And AJ, you could probably talk about this too, but and I know, Victor, you're big into nutrition, but that's one thing to pre-plan is, whether somebody's going to be staying in a hotel, in an Airbnb, they're not going to be up and cooking. So just figuring out what your nutrition options are going to be, because there's it's so easy just to order out and get things delivered, but it might not be the best quality food, but just really trying to figure that piece out before, amongst all the other things that we're trying to figure out before lengthening. But just trying to have a good plan for, where are you going to get your meals? How are you going to get them cooked? What are you going to have done? So.
Yeah. Moshe, great advice, because I think that's a missed, go ahead, HJ, I'm sorry.
Yeah, you have to plan that out because, obviously I didn't cook. That's why, because when you're on a wheelchair, you can't really cook, and just have a lot of microwave meals and easily edible foods, easily 100%. Packaged foods.
Yeah. When I was visiting you, I remember you had
food delivery.
Protein shakes. Remember the protein shakes you would have? Yeah, you had those too.
Protein drinks, yes.
Protein drinks, yeah. And I agree with what Moshe was saying. It's like prep your nutrition, guys. I mean, it's so helpful for recovery and getting back up on your feet. And it'll help you maintain your muscle mass so that you can have a faster recovery. A lot of people let their muscles atrophy so much that they have almost like a month to 6 weeks longer recovery because they don't have the muscle integrity and strength to kind of rebound fast. I'm telling you, when I started walking, I was fast, and even though I didn't have 8 centimeters in length, if I did, it wouldn't really matter because my nutrition was on point. Okay, moving right along here, we have a few more. We're going to take about 3 more questions, and then we're going to give our shout outs to Moshe and HJ, and I'll post their links in the description, and then we're going to go ahead and sayonara. But let's see here. Okay, talking about BMI. We're going to answer that one later, Darko Chiha. Okay, this is a good HJ. This is from Nico directly for you. He says, HJ, how soon after surgery were you able to use a walker? That's not.
Yeah, I mentioned it earlier. So I was in the hospital for 3 days. So at the end of day 2, I was learning how to use a walker, and then day 3, I got a little more practice, and then I was pretty much using the walker by then.
Okay.
But even though I still have to use the wheelchair most of the time, but I use a walker within my room, especially just to get to the bathroom.
Okay, gotcha. All right. So by day 3, you're using the walker. They're showing you how to get around on that. All right.
Not for walking though.
Yeah, not
Yeah.
for a while.
Well, just like within the room to get to like the bathroom or around the room, basically.
Okay, gotcha.
But I still need a
All right.
wheelchair for like anything longer than outside the room.
Yeah, yeah. That like, when did you use your wheelchair? Like besides, like, did you use it like going through the halls of physical therapy? Because I know you were on the walker a lot. How
Yes.
did you? Yeah.
Yes. I had a wheelchair. Whenever I go outside the room, like go to the lobby,
Okay.
or and also when I go to the physical therapy center next door at this Sinai Hospital, I'd have a caretaker push me to the PT center and back
Okay.
on wheelchair.
Gotcha. Yeah, that's smart. So yeah, so you don't have to like get your arms too tired and have a problem. Okay. Oh wow, we do have a lot of questions here. Let's see here. All right, we're going to take two more, and then we're going to call it wraps because we did start a few minutes late. So we'll give you guys that credit. So we'll go 3 more minutes. All right. What is the price of leg lengthening for 3 inches? Are there any extra fees? So if you want to find the prices and stuff, we're not going to do that today because it varies for every surgeon or lengthening clinic. So we won't talk about that today. I'm from Brazil. Do you guys know if there's a good doctor that I should look into? Yeah, again, guys, we're gonna surgeons we're gonna have on in the following weeks. I do have some lined up. Let's see here. Okay, so I guess this one is a good one for HJ. If a patient is in college or university who's like in his 3rd year, would it be possible to do lengthening when he's in his dorm? And do you think he can be able to do this to go to his classes? HJ.
In the dorm, with the precise tool, I don't think so, because you have to use a wheelchair. That's why, to get around. Unless you're a dorm, I don't know of any college dorms that are very wheelchair friendly.
Yeah, that'd be tough. Moshe,
But if
do you
you're
have any?
taking online classes, maybe just take a very limited class. You cannot do a full schedule
Yeah,
as a full-time student. Just take a very minimal classes.
right. Or just do it, in the summer or the winter break. Hey,
Yeah.
Moshe, do you have any patients who were ever in college when they were doing lengthening or like university and they did it on campus?
No, not that I can recall, but
Yeah.
But I think similar to what HJ was saying, I know a lot of the folks work while they're doing it, so that would be sort of similar, but you just have to be aware. And HJ, you could probably talk about this too. Is like, if you're in pain, if it's painful, if you're tired, if you're having a bad week, having to work for while you're going through that is difficult, and I would say the same thing to extrapolate to to college courses. It'll probably be that much difficult. So it's not just the physically getting in and out of your dorm room, getting to and from class. It's actually being present in class, which depending on where you go to college, it might differ, but and you have to have access. Very, very crucial. You need to have access to quality physical therapy. You can't be in I don't know, I'm just going to throw it out there, University of New Mexico, and and assume that everything is going to go great. You need to have access to quality physical therapy whenever you're doing this.
100%. I love that. Okay. We got another question here. This is okay. This is actually I guess Moshe, you can take this one as well. It's kind of a father looking for his son. He's saying, my son is 2 years old. We identified him with let me actually put it up on the screen so you can read it, because
I think it's the Hemi-Hypertrophy.
That's probably what do you see that one?
Yeah, I think I saw it in a come up
in the chat. Yeah, I think that's what he's asking here. And yeah, let me just get it. So he's asking Hemi-Hypertrophy, now a difference of 1 centimeter in the legs. Can you please suggest the right age or the proper age for limb lengthening surgery?
So definitely find a doctor who's qualified to diagnose that. If just on the leg length discrepancy, if it's just 1 centimeter at this point, I'm not sure the doctors would intervene for that, for any kind of lengthening for 1 centimeter. But you definitely want to have that monitored over the next few years. That being said, I know a lot of the doctors try to avoid the 5, 6, 7-year-old lengthenings just because of behavioral issues, which is very typical of that age. They try to do it, an initial one early, about 2, 3 years old, and then they they might wait till like 8 or 9 years old, and the child is a little bit more mature for a longer lengthening. That's pretty much been what the experience has been.
Gotcha. Okay. All right. I think we got one more. Actually, that looks like that's it, guys. Well, that's perfect timing. Well, all right. So let's see here. I think we had some outros and people were just asking some random questions here. Yeah, so here we go from Zenosama. Thank you guys for being here. This crossover has been great. I hope this multiverse will continue expanding in the future lives. Take care. There you go, HJ from Randy. Hey, HJ, please don't stop writing your blog site. I still read it. So, and the funny thing is, guys, he just launched his YouTube channel a couple months ago, but he's really fine-tuned it. It's up and active. I'm going to post it on the ticker here. Let's see here. And I have Moshe's new website where you guys can reach out to him if you have questions about physical therapy, if you just want to reach out to him and consult with him, if you want to just reach out to him and say, thank you so much for coming on to the Lengthening Live and giving us lots of value. That's going to be posted in a second here. And Moshe and HJ, let me just see. HJ, what's your YouTube? HJ, it's Height Journey?
Yes.
Okay, I'm going to put that in here and show it on screen so you guys can see it in the ticker below. So we have the website is Moshe's new website. I just copied the website link here. It's www.mrothpt.com. His email is info@mrothpt.com. And HJ's YouTube channel, where you can check out all his amazing videos that are super meticulous, have super detailed explanations of how to get around as a non-weight bearing stature lengthening patient, getting bilateral femur lengthening done, like going up the stairs, getting in and out of the shower, using the bathroom, in and out of the car, all the things that I always wondered about, he gives it to you on his YouTube channel. So even physical therapy stretches and exercises he learned from the expert over here, Moshe Roth. So you guys go check out his YouTube channel, subscribe to his YouTube channel because he's going to be posting more videos, and your support shows him that what he's doing is important and you guys value it, so he can put out some more good stuff. I mean, this is a classic stature lengthening patient right here. And we're going to have Moshe back on probably in the new year because we have some more people lined up as the holidays roll around here. But I really want to say thank you to both you, HJ, and Moshe for coming on to Lengthening Live episode 17. You guys just kicked off season 5 of this awesome series that we have going. And if you guys want to say anything to your awesome fans out there, this is your time to do it. So HJ?
Yes. I have a blog, it's still up, but I've transitioned everything to my YouTube channel. If you look at the description field on this video, you'll see the exact URL. Just click on that. Please subscribe to it. And also, if you like the videos, pressing the like button will help as well. Because lengthening is just such a very large and complex topic. And like I have like stuff that can last for like years, I think.
Oh yeah, forever. I mean, your stuff is so ingenious.
This weekend, last week, a few days ago, I posted like a 2-part introduction video of the start of my YouTube channel. So this coming weekend, I have like 2 more videos planned up to publish. And for the next 6 months, I'm going to be publishing like maybe 1 or 2 videos per week. So
wow,
there's a lot of stuff ahead. There's a lot of stuff.
Guys, like, listen to that. And we're going to have him back on the show for more crossover.
Large and complex field of lengthening.
Absolutely. Absolutely. And Moshe, do you want to say anything to your fans out there and future patients that you're going to be working with?
Yeah, not just my patients, but really it's so crucial to have a good qualified doctor for when you're going through this, who's going to, take the time and work with you. But also on the back end, having qualified experienced physical therapy, who can just brainstorm all the challenges that might occur throughout the journey. It's so important. I think people overlook that. Not self-promoting myself, but definitely promoting the importance of quality rehab and physical therapy. It's so crucial when when you're looking into this to know who's going to be taking care of you the day after surgery.
Yeah. 100%, and you are free to self-promote because you're just that good. I mean, when you're the best in the world, you can self-promote all you want. Because I wish you were my physical therapist, really. I mean, all the things you're saying are things that I found along the way. So, guys, again, check out Moshe's new website, MRothPT. Send him an email, thank him. If you have any questions about things, bounce on my ideas with him. Reach out to Moshe, and you have HJ Height Journey's new YouTube channel live right now. You can find his link to his YouTube channel. I just posted in the chat. The actual URL is actually in the chat. It's also below the video. And if you guys got email notifications, you'll have it in your email as well. Guys, I want to thank you so much, all of you guys in the chat, for coming out for Limb Lengthening Live, episode 17. And until next time, this is Victor from Cyborg for Life, Height Journey, and Moshe Roth signing out. Peace.
Bye.
Take care, guys.